Well, today we're embarking on a new program, and that is we're taking some of our major programs that we host during the year, and we will add them to our series, and we're going to call them a redux or a revival or a revived view of what we've done at those conferences in the past. And many of you were at our annual healthcare conference back in January, which was a first-class event, and at Texas Scottish Rite Hospital. Well, today is a healthcare conference redux, and so we're looking forward to basically reviving what we discussed at our healthcare conference in a much more amplified way. So our sponsors, we wanted to at least acknowledge and thank our sponsors from that healthcare conference, and let me just identify them real quickly. It's Bank of America, Blue Cross Blue Shield of Texas, Baylor Scott and White, BKD, Children's Health, HDR, J.E. Dunn Construction, Medical City, Methodist Hospital for Surgery, Polzanelli, Texas Scottish Rite, and of course UT Southwestern Medical Center. So thank you to all of our sponsors for the program back in January, but also for, in effect, sponsoring this program as well today. So thank you for the opportunity to do this. Today, I have the privilege of welcoming three nationally known people in the healthcare space and have the privilege of introducing them to you. And then I'm going to turn the program over to Steve, who will moderate as he normally does such a masterful job of that. So the first person I'm going to introduce is Dr. Trish Perl. And Dr. Perl is the chief of the Division of Infectious Diseases at UT Southwestern and is affiliated with Parkland as well, of course. She's a graduate of the University of North Carolina School of Medicine. She did her residency at McGill University in Montreal, and she did her fellowship at the University of Iowa. Prior to coming to University of Texas Southwestern Medical School in 2016, she was a faculty member at Johns Hopkins School of Medicine in Baltimore. I was noting in her profile that she wrote a paper on February 3rd. It was published on February 3rd on COVID-19. And it was called What You Need to Know and How to Reduce the Risk of Infection. This particular report that she developed was not only prescient, but it became a seminal publication on the coronavirus at that time and since then. So she's clearly a highly regarded specialist in this world and can add lots of value to this conversation today. I'm going to go ahead and introduce Dr. Huang. I'm not sure if he's on yet. I don't see him yet, but I'm going to go ahead and introduce him. I think many of you know Dr. Huang. Phil is the director of Dallas County Health and Human Services since early 2019. He is truly a native son as he grew up in Lake Highlands and as a Lake Highlands High School Wildcat. And he's armed with degrees from Rice University and University of Texas Southwestern Medical School for his MD. And he also has a master's in public health from Harvard. And Phil has worked for the CDC, the Texas Department of Health and Human Services, and immediately prior to his current role, more than a decade as the Director of Public Health in Austin. In his spare time, Phil is an accomplished musician and an amateur magician. So one comment I'll make real quickly about Phil is that if you did not read, would everybody please mute their phones if you're not speaking? Thank you. If you did not read Sharon Grigsby's profile of Phil in the Dallas Morning News 2 weeks ago, I highly recommend you do that. In that, the observation was made that Huang's admirers, and there are many, say his mix of scientific acumen, dedication, steadiness, and love for the city of Dallas, where he grew up, is just what the doctor ordered. So those are our two great panelists today. And of course, I would be remiss if I didn't also introduce our favorite person in the healthcare space in Dallas, a great friend of the North Dallas Chamber of Commerce, and always playing an instrumental role in planning and moderating our annual healthcare conference. Steve is just a real treasure in this community, and we really appreciate him. As everyone knows, Steve is the president and CEO of the Dallas-Fort Worth Hospital Council, and we are so fortunate to have him here today to moderate this panel discussion. So with that, I'm going to turn it over to Steve, and thank you very much for everyone's participation today.
Thank you, Ken. And I want everyone here to realize how lucky that we've got the two panelists that we've got. They are absolutely known, not only throughout the nation, but worldwide. They are really experts in what we're going to talk about. What we agreed was we're going to have each of them have opening comments for a few minutes. I'm going to ask a few questions. And then the most important part, we're going to open it up so each of you can ask your questions. But we're going to begin with opening comments by Dr. Trish Perl.
Good afternoon, everyone. It's a pleasure to be here and speak with you. So Dr. Huang and I tried to divide up what we were going to say, so I'll make some brief comments. He's actually on now. He was just having a little trouble with the password. So I have been charged with telling you a little bit about the virus and the infection, and then Dr. Huang will give you some updates on some of the numbers that have come out. So coronaviruses are a group of respiratory viruses that have been around for a long, long time. And in humans, they're known to cause respiratory tract infections. Everyone on this call has had a coronavirus infection. And in fact, there are four sort of species, if you will, or cousins that commonly cause the common cold, and by the age of 20, you've probably had all four. So this is common. What's different this time is that this is what we call a novel coronavirus, and there have been, at least in our recorded history, 3 novel coronaviruses. The first one was in 2002. It was the virus that caused the SARS infection that occurred worldwide. That virus and infection was literally aborted, and I will tell you why later. The second was 2 years later in 2012 when MERS-CoV emerged. That's the Middle Eastern Respiratory Syndrome, and that emerged in the Gulf area. That was much more regional, if you will, but that has been an ongoing challenge, and we continue to have infections from that. And then most recently is the SARS-2 virus, which causes COVID-19, which has emerged, and all of you are aware, likely emerged in China. Coronaviruses are what we call zoonotic. They have a normal natural host in bats. These are primarily bat viruses. But to actually infect humans, they have to have an intermediary host. In the case of SARS, it was the civet cat. All of those were culled at the time of the infection, which is why we haven't seen any more. We literally eliminated the intermediary host. For MERS, it was the dromedary camel, and that's why that hasn't emerged. It would be impossible to get rid of all the camels. And at this point, most people think the intermediary host for the SARS-2 virus is something called the pangolin, which is an adorable mammal that kind of looks like a armadillo and is considered exotic in China and is eaten, actually, which is very sad. So anyway, so that's the virus, everything you need to know. This particular virus, the COVID or the SARS-2, is very similar to the SARS-1 when we look at it genetically. Although clinically, it has features of both SARS and MERS-CoV. So what we're clinically seeing is a spectrum of illness from asymptomatic to actually severe pneumonia with all of the complications of severe pneumonia that we call adult respiratory distress syndrome. So we're seeing people who, you know, are ending up on ventilators for long periods of time, etc. We actually now recognize more that there's an asymptomatic phase or polysymptomatic, which means that, you know, people really don't even notice that they're not feeling well. And the usual duration of symptoms is about 10 to 14 days. The prominent symptoms are fever, cough, shortness of breath, and interestingly, an acute loss of smell and taste. And that's been actually very characteristic. And we actually see it in people who are asymptomatic. So it you know, presents very with a wide spectrum of illness. The most dramatic and important risk factors for severe illness or the complications are age, and it goes up with each decade of age, starting at about age 60. And then secondarily, diabetes is an important risk factor, as is heart disease and underlying lung disease. There are other risk factors that are important, and we're beginning to understand those more and more. But unlike SARS, this seems to be an illness that really has a predilection for people who have some kind of comorbidities associated with it. What works in terms of prevention, like what can you do individually as people? So hand hygiene actually works. I know everyone doesn't think it's an interesting thing to talk about, but both alcohol, hand gel, and washing your hands actually reduces the risk of transmission of any of these respiratory viruses by 50%. So it's not trivial, and frequent hand washing is an important part of a prevention strategy, whether it's for you personally, your family, or for a business. Secondarily, this virus does live on surfaces for short periods of time, up to maybe 48 hours. So cleaning has also become a very important part of prevention in that. It's not a particularly hardy virus. It's pretty loopy. So a lot of the common cleaners that you have in your home are adequate. Alcohol will also kill this virus. And then there are the things that are more prominent that we're all seeing currently, which is wearing masks, which will prevent the transmission. This is primarily respiratory transmitted, 3 to 6 feet in what we call droplets. So that's how flu is transmitted, pertussis, a lot of infectious diseases. And so that's the reason that the masking has become part of the strategy to prevent that. Social distancing is also a component that's very important. And the 6 feet comes from what I was just explaining to you. These droplets that you cough or spit or whatever usually go about 6 feet. And so that's this whole concept behind the social distancing. It's actually been shown to prevent transmission in classrooms, so there are actually data supporting that. Other things that we are recommending is that people stay home when they're sick. I know that sounds obvious, but there is a culture of presentism where, you know, life will not go on without me being present. And so, you know, just reinforcing that has become very, very important. Coughing in your sleeve as opposed to on your hands. So just really basic basic things actually prevent a lot of transmission. There's no real risk that's been described associated with the food supply or water or some of these other issues that have been suggested in the lay press. I would say there's a lot of misinformation out there about this, and so I'd encourage you to look at the State Health Department website, Dallas County's website, the CDC website, but really go for these websites. Actually, UT Southwestern has a great one. Just any of these websites that are supported by organizations that you can trust. And I think I can stop there unless, Steve, there's anything else you want me to cover and let Phil take over.
Okay, thank you so much. That was very, very helpful. And Dr. Huang, we'd like to hear from you. Your audio's not working, Phil.
I can text him again. Let me text him.
Phil, can you hear me?
Yeah.
Okay.
Can you hear me now?
Yeah,
okay.
now we can hear you.
Because I had to use a phone separately, right? Is that right? It says *6. Got it. Okay. Well, sorry about the technical glitches here. No, appreciate the opportunity to speak with you all and to be on with Dr. Perl. So Jess, I'm going to start out with sort of an update where we are right now in Dallas County. So today we're reporting 71 new cases, bringing us up to 2,834 total cases. We also have cases in the jail setting, in some homeless shelters, in the nursing homes that we've been reporting. It's definitely the spread that we've seen it in our community. It's continued to grow. I have some charts sometimes that been showing, and you can get these from various sources, but where you compare like the 10 largest counties and the rate of growth in terms of numbers of cases. And this chart is only it starts on March 1st, so it's only been like a month and a half, 2 months now of data. And what's striking, the first chart when you do the 10 largest counties, as of March 15th, March 17th, we were all right around the same number with very minimal numbers reported. And then New York just takes off, and they're now up to 120,000 cases in New York City. Then there's the other cluster of the other 9 largest counties that are at the significantly below that you have to sort of take off New York City and then look at that chart just to see how those spread out. You've got Cook County at about 18,000 cases, Los Angeles around 11,000, Miami-Dade, Harris County's next, and then Dallas is in some of the lower numbers with the rest of the large counties in the country. But I point that out because it shows just how quickly in a short time this can explode and just exponentially grow in terms of the numbers. When it's been talked about with New York City, again, we were all at the same level just a little over a month and a half ago. But they say that they were maybe a week late in implementing some of the physical distancing policies, the shelter in place, that would have prevented some of that exponential growth. We in Dallas, I think it was, March 16th that the judge's order first closed bars and restaurants. And then it was March 24th that the stay home, stay safe, shelter in place order went into effect. And so, what we can't underappreciate or take for granted is how much these efforts, the sacrifice everyone's been making, the orders that have been in place have impacted this growth, the spread of the illness. And what we've been, saying also all along is, for public health, this is what we do all the time is, try to identify cases. We do the case investigations and contact tracing where we interview the people and try to identify who was, in contact with them during the period when they could have spread the illness, and then follow up on them and, tell them to quarantine for 14 days, things like that. We're doing it on a large scale with this. Thus far, we have continued to do that contact tracing with all the cases we would get reported. And we've talked about, initially we're trying to contain this effort, but then also the mitigation, once the numbers get so large, you have to implement these policies, the shelter in place orders to really slow the spread down. And, the whole goal of these efforts is to save lives and was also to protect our healthcare system, because, you've seen what's happened in China, in Italy, in New York, if you don't, and how it can totally overwhelm the healthcare system. And so that's what, and showing these and looking at the data, and Dr. Perl's leading some of our efforts, looking at, how do we move forward from here. But the point is really, no one should underestimate or take for granted what impact these have had in slowing down the rate of infection in our community. And so as we proceed forward, we really have to be very careful in how things are opened up, that we need to have things in place to be able to monitor and make sure that it's not opened up too quickly, so that we go back to that exponential spread that we've been trying to prevent all along. And again, Dr. Perl, Steve Love also are, working on some of these efforts and leading these efforts to do so in a very systematic and sort of evidence-based way. But that's sort of where some of the efforts are now. The governor has sort of relaxed some of the restrictions. We're trying to work within that construct to see what makes sense, what's going to work, but make sure that we have things in place, again, to monitor the hospital admissions, ICU, bed usage, those things, as well as number of new cases. One of the things that we've said also before you really want to open up is to make sure also that there's adequate testing in place, because that's going to be a key piece as we move forward, to make sure we can test people. We can, get into nursing homes and test people to try to control these and know what's going on out there. That we've got the test, the PCR test that identify making the diagnosis, but we're also interested in the antibody tests to be able to identify who's actually been infected, who has protection, and those are things that are still being developed and are new. And so I think we're still trying to see how that testing capacity grows. It's going to be important for us to move forward, as well as availability of personal protective equipment. Those you've heard about the N95 masks and all that, so that we are prepared for how things move forward. But I think let me leave it at that. We're at a stage. And again, Dr. Perl, Steve Love have been working with us also, and all the modeling efforts with the various hospitals, institutions, the universities, UT Southwestern, to look at what are the projections, what's the data we have to try to estimate how it's going to, where we're going, what's the impact of all the different restrictions we have, and what's going to be the impact of lifting some of those restrictions. So again, let me leave it there, and then I think we're both open for questions.
Thank you, Dr. Huang. Dr. Perl, let me ask you this. Dr. Huang talked about modeling, and many of the people may not quite understand the sensitivity of the modeling, how contagious this is, the doubling effect. Can you elaborate a little bit on that?
So, yes, I can. First of all, I just really want to say two things before I answer that question. One is, I really think we have been fortunate with the leadership that the health department has taken in this, in that, we really have been lucky, and the modeling has borne that out. The second thing I'll say is that from an epidemiologic point of view, we have looked at this almost regionally. It's really hard because viruses and infections don't know borders to look at this just from a Dallas County point of view. There are a lot of people who live in Tarrant County and work in Dallas County, or live in Collin County and work in Denton County, and all of the permutations they're in. And so, you know, from a control mechanism, it's been important. So what is modeling, and what are we doing in terms of modeling? I think probably there are a lot of people on the call who do a lot of financial modeling. And modeling is a relatively new tool that's come into the world of medicine and public health. And essentially what it does is it allows us to take certain information and predict things. For example, it's allowed us to predict when the epidemic will potentially hit certain parts of the country. We can use it also to estimate the impact in estimating what it would do to healthcare resources. There's been a lot of different groups and a lot of healthcare institutions who've been looking at the potential impact on their beds, on their ICUs, on ventilator use. It's allowed people to actually model PPE burn rates. You know, each of these institutions is going through a variable amount of PPE. If you're a place like Parkland that's had many, many cases, they're going through a lot of PPE to care for these patients. So we use it in that way. It's also been a very helpful tool to look at the impact of various interventions. You know, a lot of people are second guessing, you know, how important has this been, or does hand washing work, or does masking work? And these are important questions that we need to answer, not only for ourselves, but for all of you. So we use modeling to predict, but also to measure the impact that certain interventions have had. And we use it to track not only the course of the illness, but to actually to track our resource utilization. And we've been using it to look at our outcomes and to predict our outcomes. So does that answer your question, sort of?
Yes, yes.
Yeah, I guess the only thing I didn't address is you were asking about doubling times and things. I should mention that. So there are some very key factors that we watch to see how epidemics are evolving over time. And the two terms you're going to hear a lot about are doubling time, which is essentially a measure of how quickly the epidemic is doubling over a period of time. The almost inverse of that is something called the reproductive number, and you also may hear that called the R naught, which is an R with a little sub-zero. And that is essentially a measure of if I, as a person, have COVID-19, how many people will I transmit it to? So just to give you an example, when we started this epidemic, on average, every person with COVID was transmitting it to 3.8 people. So that's a lot. Just think about it. So if you then transmit to almost 4 people, and then those 4 people transmit it to 4 more people, you can see how quickly an epidemic will double. Currently, so when we started in the Dallas-Fort Worth area, our reproductive number or doubling time was around 3. And we're actually down to about 1 when you look at all the 4 major counties. So we have made huge progress in terms of really getting the numbers down. Now, you do not abort an outbreak until you're under 1. So we are still in a phase where we will have ongoing transmission, and that's the challenge for the public health groups, but as well as all of you, is that, you know, we now have to balance this opening with keeping that R naught low.
Thank you, Dr. Perl. Dr. Huang, let me ask you this. Many of the people that are participating here today know Wright Lassiter III. His father used to run the Dallas County Community College system. He's a hospital CEO, and he runs the Henry Ford Hospitals in Detroit. 2 weeks ago, 700, not patients, 700 of his employees tested positive for COVID-19. I can't imagine running a hospital when that many of your workforce has COVID-19. How would you, when you talk to your counterparts, how would you compare Dallas and our community with other parts of the country that have dealt with this?
Well, and again, as I was describing, you know, there's quite a variation in terms of the impact of where, you know, what we've seen, and we've seen some of this on the news, or, you know, I've actually been on, you know, where you see communications from some of the frontline physicians in different areas. I saw some early on from New York City. You know, I mean, that was what is really scary, the level. The frontline workers in some of those hospitals in New York describing how exactly what you were saying. It's like every other physician was coming down with it, and they were, you know, I mean, and there were, you know, severe illness in the staff. You know, it was almost, you know, they were talking about they were having this sense of inevitability that they were going to be infected. There was lack of the personal protective equipment to keep them safe. You know, I mean, you've seen the pictures of the, you know, having to manage the deaths and the dead bodies even in those settings. And so certainly that's the reality that we're hearing from other areas of the country. New York, I think, in the United States has been the hardest hit. Yeah, again, Chicago. Was hearing more about Detroit. Haven't heard lately about that area, but I mean, what you're describing is consistent with some of the numbers that I have been hearing. So, you know, it's just another reminder that how fortunate thus far we have been, and to not take that for granted, because it could very easily have been that for us, and it's still, we are doing everything we can to prevent that. But there, you know, it's going to take that continued vigilance to prevent, you know, something further spread, and because it does take off so fast when you get, you know, when it gets out of control.
Right. Thank you, Ken and Jeff. I think we've come to one of the most exciting parts of this, and that's to allow the people on this to ask Dr. Perl and Dr. Huang their questions. So I'm going to turn it back over to you as far as how you want to go through that process.
Great. Thanks, Steve. Really appreciate it. We have multiple questions in the chat function, and if anybody would like to go ahead and issue some additional questions, please feel free to do so. What we typically do in our events is we'll actually call on you to actually ask your question. So if that's possible, please unmute yourself and ask the question, but I'll call on you. And if it's not possible, I'll ask the question for you. So first question is from Craig Perry. So Craig, are you available? All right, if not, then I'll go ahead and ask questions. He said, yesterday I heard a professional state that the use of gloves was unnecessary. Is that true?
You want me to take it, Phil?
Yeah, sure.
Yeah, okay. So I think it really depends on the setting that you're talking about. A lot of people, so in the healthcare setting, I would say that's not true. I think it's very clear that in healthcare settings, we should be using gloves. It becomes a much bigger point of contention, I think, when you move outside of healthcare settings, because there's just simply less data available on how useful they are. So gloves are not going to hurt. What people don't understand about gloves is that they are not a substitute for hand hygiene. So gloves, any of these latex gloves or that you have, all have microperforations in them, and the organisms can get through that. So people think that they're getting additional protection with the gloves when they're commonly not. There are some settings where using gloves does make sense outside, and we would certainly say that if you're picking up any kinds of secretions or anything like that, that actually translates more to like the medical types of use. So, if you're cleaning up vomit or, something like that, then we would recommend it. But I mean, I see a lot of people who are handling packages, using gloves, and honestly, without, in the setting of hand hygiene, I'm not sure that really adds that much. I don't know, Phil, would you add anything?
Yeah, just that, when people use the gloves, then, you got to make sure then they don't still rub their eyes and nose and mouth with it. And again, the hand hygiene is still important. And there are other things. Having gloves just doesn't protect you. You still can get the gloves themselves get contaminated. And so.
Okay, thank you. One of the past board chairs of the North Dallas Chamber of Commerce is Ron Chapman with Ogletree and Deacons. Ron, are you available to ask your question?
I am. Can you hear me?
Yes, please.
Okay. Dr. Perl, in your introductory remarks, you stated that mask.
Hey, Ron, you're breaking up on us. Hey, Ron, you're breaking up on us. Why don't I go ahead and ask your question for you, if you don't mind? So I think he is directing this to you, Dr. Perl. Will a mask prevent respiratory transmission, as you stated, or help prevent respiratory transmission? If the latter, by approximately what percentage if using a typical cloth covering?
The answer is in healthcare, we know that the use of regular masks reduces transmission of respiratory viruses anywhere from 70 to 90%, depending on what kind of mask you're using. I will say that the data are a little less clear in some of the household studies that have been done and some of the studies that have been done in, there have been studies done in colleges, and it's just really been around the issue with compliance, like how compliant have people really been in those settings, and so it's just less clear. So that's what we know about masks. We actually think they do prevent transmission if utilized importantly. Cloth masks, there's less data out there, and a lot of us are struggling. What we do know is that it prevents you from touching your face, which has been very important in all of this. It will, again, prevent some of that droplet from being, spit or coughed out, and so we think that's important. But we don't really know whether cloth is going to afford the same kind of prevention that a regular mask has. We just, is the penetration adequate, et cetera. So there are some unanswered questions in that arena. Does that help?
That's great. Thank you, Dr. Perl. Appreciate that. So let me just keep moving along here. This question is from Dr. Tim Church. Tim, welcome. We're glad you're with us. And I don't know if you're available to ask your question or if you want me to ask it.
No, I'm absolutely available. First, I want to say thank you. I am boarded in prevention and public health, and the moves that have been made in Dallas County have been aggressive, remarkable, timely, and you guys will never get the credit for what you did. You've saved thousands of lives, and you've really minimized the impact to the economy, so thank you. As you look at other countries or other places that opened up too early, and the primary source of reinfection has been travel, in particular air travel. As we open up DFW, do you have concerns or do you have any thoughts on strategies, particularly business travel, we might want to think about as we all take to the airways again? Thank you.
I guess I'll start, but I mean, definitely the points you make and the concerns are very important. I think that, again, Dr. Perl is leading one of our expert groups with the healthcare, representation, and Steve Love, others, to look at these, and make recommendations regarding exactly what makes sense in terms of opening up and what considerations need to be made. There are several resources out there also. There's the American Enterprise Institute document. There's a follow-up publication by Johns Hopkins with guidance for governors even on implementing and opening up things. But no, those points are very important, and that's what I think everyone's trying to look at, the evidence regarding how to do that and take into consideration these things, and make sure we can monitor and evaluate after some of these things have been opened up, to give it time to see exactly what's been the impact. But to Dr. Perl probably has other things to add to that.
Yeah, I think we're going to have to see a paradigm shift in travel personally, at two levels. One is that this is one of several examples of an emerging infectious disease that was associated with travel, and it's not part of medical culture to really ask about travel. We ask you guys a lot of things, but when was the last time until recently someone asked you about your travel? And so I think in medicine, that has to become almost a vital sign, if you will, where we really start being much more thoughtful about the kinds of questions we're asking patients. And so in terms of one thing, I think we have to sort of think about how we in medicine are going to be helping the business community as this opens up. The second thing I would say is that, after 9/11, everyone thought it was going to be the end of the world that we had TSA screening. And it was kind of painful for a while, but now we have all sort of gotten used to it, and it's been streamlined. And I'm certainly not an expert in it, but I think there are people out there who will tell you that it's been helpful in protecting the airline industry and all of us. And so I'm guessing that we're going to see a lot of changes in the airline industry in terms of, we'll be asked to wash our hands or to clean our hands with alcohol hand gel when we get on an airplane. We may be handed a little cloth to wipe down the little tablet thing that we use as a table. There could be, we may be asked to wear masks. I mean, I don't know, But I think that we will also not only be trying to monitor this, as Dr. Huang said, but really we may see industry changes in just, what this looks like in terms of how we travel. We may actually only be allowed to sit every other seat, which will be great, Economy class will become first class. So I don't know,
yeah.
but just things like that.
So when we hear from Derek Kerr, the Chief Financial Officer of American Airlines, he often quips that if you want to really truly be socially distanced, get on one of our planes. So that's what's happening in that space right now. We may have to go to a lightning round because we've got a lot of questions here. So let's see if we can move through as many of these as we can. I'm going to go ahead and just start asking them in the interest of time. So from Ben West, the question is it necessary to wipe down groceries or take out food containers when bringing them into your home?
I'll let Trish answer that one.
You're killing me, Phil. Yeah, I mean, if you want to be really careful, yes. I don't know that there's any data supporting it one way or another. I always wash my fruit and my vegetables anyway, so I think it's fine, but I don't really know the answer. I don't think it's going to hurt anyone at all, but I'm not aware of any public health recommendations saying you should do it.
Okay, great. Thank you. From Tina Young, our next year's board chair of the North Dallas Chamber of Commerce, she has a question that says, can businesses that have an open office environment reopen safely if they use masks and sanitizer and hand washing guidelines? Seems tough to be in a same space closer than 6 feet if we don't have testing to know that no one has COVID-19.
And I'll go ahead and start on that one. I mean, there are recommendations and guidelines for businesses to open. I mean, it's a broad and just for businesses to operate and prevent the spread. I mean, it includes things like, making sure your leave policies support people staying home if they're sick. It includes the environmental and facilities, cleaning and cleaning those surfaces are frequently touched. It includes the, physical distancing and separation. And now, we've got the orders for if you're in a workplace and that there are multiple people to use the cloth coverings to prevent that. And, the cloth coverings are largely because of that increased recognition of asymptomatic spread and infection. So, I think, and still maintaining all the hand washing and all these other things. Those are, we know how it's spread. It's not magic. And so all the things that help, promote those physical distancing and other hygienic practices are important. And things that violate that then are not good. And Trish may have more to detail, but.
No.
Okay, great. Angie Freed, the general manager of the Galleria, she has a question. And I'll just paraphrase this, Angie, if it's okay, but it's in effect to Dr. Huang. What should we expect next from you and Judge Jenkins in terms of an announcement relative to the May 15th date or anything else?
Well, and we've been, working with the area experts in health, in business, all of that. I think, everyone wants to get back to a level of what, has the least impact economically. But at the same time, we are, first and also foremost, protecting health, protecting lives, saving lives. And so, I think the way that we framed that May 15th date is there's going to have to be a baseline sort of level of protection that's, staying home is still going to be a good recommendation of minimizing contact, and overlaying then there will be these, opening up of selective things, again, trying to work within the framework of whatever the governor's orders are coming out with. So that's where, but at the same time, having the monitoring in place and making sure that we don't overdo it and overly relax something at the same time. So, I think we're all monitoring. We wanted to have that evidence of 14 days of decline in all of the indicators before we start, opening things up. And then after things are opened up, have that chance to evaluate. So, but I would say that, even though it goes out to May 15th, we're not saying that everything stays exactly the same. We're trying to work within, these other frameworks and selectively comply with the openings or relaxations that are out there, but have that baseline protection. So I don't know, after May 15th, again, it depends on where we are, what the data is showing, how all the modeling is looking.
All right.
So that's my thought.
Well, Phil, staying on that same wavelength, Stephen Angelette from Polsinelli asked the question, about what's your modeling show if we open for business, at least on a phased-in approach in mid-May, what does that translate into relative to ventilator capacity and hospital bed capacity, et cetera, if there is a spike again?
Billy, you want me to take that?
Yeah, that's sure. That'd be great.
Yeah, and Dr. Huang, it will pipe in because he's also been, he's really helped bring all these different groups who are modeling together in the county or the region, and there are a lot. So a couple of things I would say about this. First of all, there is more and more scientific evidence, including modeling, that suggests that this is not the first wave of this that we will see. And some people think we'll have another wave either in the fall or the late fall, early winter. And coronaviruses can be seasonal, so I don't think anyone should be unprepared for that. There are many of us who have looked at different ways of modeling this, and if we take the pedal off too quickly and too abruptly, we know that that R0 I was talking about will go right back up and put pressure back on the healthcare systems. So as this is done, keeping social distancing and some of these other measures in place is going to be key. And that's going to be your all's challenge, is how do you do this in a way that we can keep social distancing and other practices in place, safely protecting the population, but also safely protecting the economy.
Great, thank you. So Jeff Kittner has a question, and he has his sidekick Sophie there with him as well. So Jeff, by the way, is not only the COO of the North Dallas Chamber of Commerce, but he's also the Park Board representative for District 11 in the city. So Jeff.
Thank you, Ken, and thank you, doctors. As I think everyone knows, most of our recreation these days has been limited, walking and some biking. I'm getting a lot of questions about, when will we be able to open things like golf courses and tennis courts and tennis centers. Do you all have any thoughts on when those sports might be safe to play? Obviously, some other team sports like, football, soccer, that's going to be a longer way away, but some of the sports that have more social distancing, can y'all talk about the spread when engaged in those and when we might see those facilities again?
I'll say one thing. I think the governor actually clarified, I believe the last I saw was that golf courses are open, but none of the clubhouses or anything are open. So that was something that came from the governors. And again, it's sort of been waffling back and forth, but I thought the last I saw was that golf courses were open.
Yeah, I think what I would say is I would actually direct everyone, and we can make sure that we get a copy of this to the appropriate person, but there was a really nice document put together by Hopkins. They got it's like, almost like a white paper, and they got a lot of people together to look at this. A lot of these activities that you're talking about outdoor are considered low risk. There's, automatic social distancing in place, but I think that some structured approaches such as that, identifying things that are lower risk, are going to be important as you roll this out. I mean, just speaking for me personally, without any kind of institutional attachment, I would agree that the things you've outlined, I don't know what pickleball is, but I know what tennis and golf is. And, I would think those are pretty low risk, activities, especially if they're done outside and people, you have one person per golf cart or something like that, but I think you can really start thinking out of the box in terms of how to do that safely.
Great. So we've reached our appointed time. We have many, many more questions, but we need to be respectful of Dr. Perl and Dr. Huang's time. I'm going to allow one more question, and it's from Bill Hethcock of the Dallas Business Journal. And his question is, are any of you concerned about that any of the cities or counties are reopening businesses too soon? And if so, what are those concerns?
And, I would say, as Dr. Perl mentioned at the beginning, as a sort of a metro area, we were all very dependent and interdependent on each other. And so, some people may live in one area and work or travel to others. And so, what happens in all of our area can affect all of us. So I think we would have concerns if there were some place that we're not doing things in a careful manner, the impact that could have negatively on all of us. So,
yeah. The importance of collaboration, county collaboration, that was not real well coordinated up front when the restrictions went in place. And it was very challenging for the various jurisdictions. Sorry, Dr. Perl.
Yeah, no, I would just say I think we have to be very careful. I told you the R0 is at 1, which means this epidemic is still propagatable very easily, and we would like to see it below 1 and actually see, 14 days without any growth. And we're seeing a little blip right now. We wonder if that's not related to some of the lack of social distancing that occurred over the Easter holiday. And so we have to watch that as a community. So I would just caution everyone that, we're potentially being a bit more aggressive. And because of that, we have a lot more responsibility in doing this very, very cautiously, because I do think there are some indicators out there that we could rebound pretty quickly.
Okay.
Do you have any specific examples of communities or cities that are or counties that still are not or maybe reopening too soon or don't have the right policies in place?
Yeah, if those want to take it.
No. I was just, again, we're all also working under the governor's orders. And so that there's a framework there that the other counties have to fit into. I heard and saw some media reports. I think it was Colleyville in Tarrant, I believe, that was looking at opening up things more quickly than others would recommend. So that's one that I'm aware of. But
yeah. All right. You know, I made a mistake. I forgot that I've been meaning to call on Mitchell Gleber, who's the president of the State Fair of Texas. He had a question all along, and so I'm sorry, Mitch, I hadn't recognized you. So Mitchell Gleber.
Oh, no problem. Thanks, Ken, and thank you to both of the doctors for joining us. My question is related to large gatherings, specifically in the fall. September 25th is the opening date for the State Fair of Texas, and we're trying to get a feel for, you know, where we think we'll be at that point. I know y'all don't have a crystal ball, but just what your thoughts are.
I'll let Trish be the first one on that one.
Oh, I can't believe you're doing that to me. You know, I think, I don't know really what to tell you. What I can tell you is I think we will have a much better handle on this in 2 weeks. I really do. I'm not trying to turf it, but I actually think we'll know if this little blip we're seeing is a real blip. We'll know if we're continuing on a downward trajectory. You know, I would say, if possible, try and give us a couple of weeks to really get a better handle of this. But I can tell you that probably there's going to be a cautious approach to reopening, with smaller gatherings first, see how they do, then perhaps larger gatherings would be my sense of how this might unroll.
Phil, would you like to supplement that?
Yeah, I mean, I'd echo that. I mean, we've been learning more and more, you know, from the start every day. We need to keep monitoring and seeing how it progresses. And so, you know, but we've also said until we have a vaccine, that's going to, you know, be one of the things that's going to make it difficult to do some of the larger scale probably openings. But so that would be just something in mind, you know, I would think keeping in mind. And if we're thinking about there may be more activity in the fall, just a lot of different factors. I mean,
yeah. All right. Well, to all of you who submitted questions, thank you. I'm sorry we couldn't get to all of them today, but again, we need to be respectful of everyone's time here. And I want to thank Steve and Drs. Huang and Perl for their insights and perspectives on the hot topics du jour in our world today. And as a very small token of our appreciation, the North Dallas Chamber will be making a contribution in your name to the North Texas Food Bank. And we also want to thank all of our annual healthcare sponsors, healthcare conference sponsors that were very active at our annual healthcare conference back in January, and particularly being part of this Redux event today. And last but not least, we want to thank all of you that are on this call today. Thank you for your engagement in the community, your interest in what's happening in our community. Please partake of our remote learning series. We have 2 significant Civics for Business events next week, one on the arts and the impact of COVID-19 on the arts in the Dallas area. That will be on Monday. And then next Wednesday, we will be featuring another healthcare related topic, and that will be featuring State Senator Nathan Johnson, who will be talking about Medicaid expansion and why he believes that this is the time to be taking this on because of the pandemic and its impact on our communities. So with that, we are adjourned, although I will make one other comment. We rely on our sponsors for these incredible events and these great learning opportunities. But we also would be remiss if we didn't ask all of you who are not members of the North Dallas Chamber to consider becoming a member of our chamber and helping us support this virtual learning series and hopefully getting back to our traditional programming in the future. So thank you very much for your involvement today. I hope everyone has a wonderful weekend. Thanks again to Steve, Dr. Perl, and Dr. Huang. Have a great day.